welcome back to my space. And if you are visiting this channel for the first time, you are also highly welcome. In this lecture, we'll be looking at the obliterator internus muscle. Using this image by the side, this is where we have the obliterator internus muscle that is harrowed here in yellow. In this lecture, we'll be looking at how this muscle originates and where it finally inserts upon. Also highlighting the features that you should know as students of anatomy. This is where we say we have the obliterator internus muscle here, harrowed in yellow. So obliterator internus muscle is a bilateral fan-shaped muscle that is seen to originate from this region that is harrowed here in black, and finally seen to insert laterally at this further edge that is also harrowed here in black. This muscle, from where it originates from to where it finally inserts upon, it is seen to have two sub-regions. It is seen to have the pelvic region, which is the region that is located within the pelvic cavity, and also seen to have a gluteal region, which is the region that is seen within the gluteal space. So from where it emerges from to finally where it inserts upon, and considering the course that it runs, running through this part, it is seen to run through two sub-regions. So it is seen within the pelvic cavity, and it is also seen within the gluteal region. The pelvic cavity, it is seen to form the lateral pelvic wall. If you look at this image here by the side, this region that is harrowed here in black is the region where the obliterator internus muscle emerges from. And from where it emerges from, you see it directed laterally, where it will be exiting the pelvic cavity. So from this space, from where it emerges from to the point where it exits the pelvic cavity is the pelvic region, and it is seen to form the lateral pelvic wall. If you've seen my lecture on the lateral pelvic wall, you see that the obliterator internus muscle is one of the muscles that we highlighted as forming part of the structural component of the lateral pelvic wall. Upon its exit, it is then seen within the gluteal region, and this is the gluteal region of the obliterator internus. And within this space, it is seen to form the structural component of the deep layer of the gluteal muscles. If you go back to our lecture on the gluteal region, in that lecture, we sub-classified the muscles of the gluteal region into two compartments. We have the deep compartment and we have the superficial compartment. This group of muscles that is exposed here in this image is the deep compartment. And the superficial compartment is seen to be overlying on the compartment. So within this deep compartment is where we have the obliterator internus muscle that is harrowed here in yellow. So you see that the obliterator internus muscle is seen to have the pelvic part and also the gluteal part, considering the part that it runs from where it originates from to where it is finally seen to be inserted upon. And around this gluteal region, you see that this muscle is seen to run laterally before it is finally inserted on the greater truncator of the femur. Along this course, it is seen to run over the hip joint. The hip joint is seen to be embedded deep to this region that is harrowed here in blue. And you see that the obliterator internus muscle is seen to be crossing over this joint. And this is where it is helping to reinforce this joint and also strengthen the connection that this joint creates. Now let's go to the next slide where we'll be describing the specific details on how the fibers of the obliterator internus muscle emerge and also where they are finally inserted upon. Using this image by the side, this is where we have the obliterator internus muscle here that is harrowed in pink and also highlighted here in red. The obliterator internus muscle is seen to originate from the internal surface or the pelvic surface of the obliterator membrane and also the border of the obliterator foramen. Let's first dive into the details on how the fibers of the obliterator internus muscle emerge. This is where it emerges from this region that is harrowed here in black. If you look at this region, we have a number of structures deep to this space that is not exposed in this image because the fibers of this muscle is covering over it. So if you try to extract this region, this is the kind of configuration that you would see on this other hand. This is the anterior view of the pelvic cavity. This is the bony pelvis, and this region that is harrowed here in blue is obliterator foramen. The obliterator foramen is formed by alignment of different bones. We know that the hip bone is made up of the pubic, the ilium, and also the ischium. So if you look at this configuration here, around the anterior region of the hip bone, this is where we have the body of the pubic. We've tried to describe this also in details in our lecture on the bony pelvis. If you've not checked up that lecture, please kindly go and do so. This is the body of the pubic bone. And we know that it is through the body of the pubic bone that we have the formation of the pubic symphysis. So the body of the pubic bone on the right and that of the left will unite at this point to form the pubic symphysis. Also from the body of the pubic, we have two extensions. We have a superior extension that is referred to as the superior ramus of the pubic. And we have an inferior extension here that is also harrowed here in gray that is referred to as the inferior ramus of the pubic. So we have two rami extending from the body of the pubic bone that is located in the anterior region. Now, if you go more posteriorly, this is where we have the ischium. The ischium is also seen to have an extension, and this extension is what is harrowed here in yellow. This extension is referred to as the ramus of the ischium. So if you look at this alignment, you see that you have a number of rami contributing to the formation of the obliterator foramen. So the obliterator foramen can be said to be formed by the superior and the inferior rami of the pubic, so the ramus of the ischium. And this is what is highlighted here in this image. So this opening is created, and this opening is also further covered, but incompletely, by a membrane. So if you try to use this other side, this is where we have the obliterator membrane here, highlighted in green. So obliterator membrane is seen to cover, but incompletely, the obliterator foramen. And this is why it's saying to leave a space at this edge that is harrowed here in black. And this is what is referred to as the obliterator canal. So this opening is created for the passage of structures. So you have the obliterator vessel passing through this opening that is referred to as the obliterator canal. So if you look at this other side of the image, let's go back to the point where the obliterator internus muscle emerges from. This is where we say we have the posterior view. Remember, this other side is the anterior view. So posteriorly, this is the kind of presentation that you have from the bony pelvis, viewing it posteriorly. So at the posterior end here, if you drive in deep into the origin of the fibers of the obliterator internus, at this region that is harrowed here in black, you see that the fibers of this muscle is covering over the obliterator membrane, also the obliterator foramen. But if you try to remove these fibers, you see that the kind of configuration that you would see is what we highlighted on this other side. So if we look deep, we now see that the fibers of the obliterator internus muscle will be seen to emerge from the internal surface or the posterior surface of the obliterator membrane, and also the internal surface or the posterior surface of the obliterator foramen, because these structures that we highlighted are embedded in this space. So this is where the fibers of this muscle would emerge from. It's also important to add that we have the obliterator externus muscle. This obliterator externus, just as the name implies, it is externally placed. It means that the fibers of this muscle will be seen to originate from the anterior surface or the outer surface of the obliterator membrane. And this is why it is so referred to as the obliterator externus muscle. If you look at the pattern of origins of the obliterator internus and the obliterator externus, you see that the internus would emerge from the posterior or the internal surface of the obliterator membrane and also the border of the obliterator foramen, while the obliterator externus will be seen to originate from the outer or the anterior surface of the obliterator membrane and also the obliterator foramen. So this is how they originate if you try to compare these two muscles. But going back to our obliterator internus muscle. So after the origin at this point, you see that the fibers are collected together and are directed through the lesser sciatic foramen. Then we have the lesser sciatic foramen here, highlighted in dotted yellow. Even though we have a greater sciatic foramen that we described in our lecture on the piriformis. This is where we have the greater sciatic foramen here, superiorly, that's highlighted here in dotted gray. This is what gives the passageway for the piriformis. So inferiorly, we have the lesser sciatic foramen. This lesser sciatic foramen is where the fibers of the obliterator internus muscle will be directed through. And this is how they now exit the pelvic cavity. And this marks the end of the pelvic region of the obliterator internus. Upon this exit, the fibers of this muscle are then seen within the gluteal region. If you go back to how the lesser sciatic foramen is formed, we say that this foramen is formed by the sacrotuberous ligament. So we have an indentation that is created here on the ischium, and this is what is highlighted here in blue. This is referred to as the lesser sciatic notch. It is a notch because it is an indentation, and it is specifically created on the ischium at this posterior end. So it is this indentation that is then transformed into a foramen. and this is done by the sacrotuberous ligament. This is the sacrotuberous ligament here, highlighted in yellow. So this sacrotuberous ligament is what is seen to transform the lesser sciatic notch into the lesser sciatic foramen that is highlighted here in dotted yellow. So this is how the lesser sciatic foramen is formed due to the transformation of the notch by the sacrotuberous ligament. And this is what gives the final exit. And through this foramen is how they exit the pelvic cavity. So now they are not seen within the gluteal region. So in the gluteal region, the fibers are seen to run laterally and finally inserted here on the greater truncator of the femur. And this is what is highlighted here. So this is how the fibers of the obturator internus muscle originate and finally where they are inserted upon on the greater truncator of the femur. And at this point, where they are finally inserted on the greater truncator of the femur, you see that they blend with the tendon of the gemini muscles. We have the gemini muscle located superiorly and inferiorly to the obturator internus. And from this lateral head, you see that we have a collection point where it is seen to blend with the tendon of the gemini. This is where we have the superior gemellus muscle, and this is where we have the inferior gemellus muscle. These muscles also form the structural components of the deep compartment of the gluteal region. You see that they now at this lateral head are seen to blend with the tendon of both the superior and the inferior gemini muscle. And this is what is harrowed here in purple. It's also important for us to add that if we go back to the point where the fibers of the obturator internus muscle emerge, at this point here, we have a bursa that is arrowed here in green. This bursa is created between the obturator internus muscle at this point, and also the posterior surface of the ischial tuberosity. This is where we have the ischium, and this is where we have the tuberosity of the ischium. So you see that this bursa is sandwiched between this muscle and also the posterior surface of the ischial tuberosity. And this is where it is seen to reduce friction between this muscle and also this bone. Because this muscle is seen to form an alignment with this bone at this point, so this bursa is created to help reduce friction. And look at other important features that we should know when studying the obturator internus muscle. We already highlighted the obturator foramen, the obturator membrane, so the obturator canal. We try to use this upper image here. This is where we have the obturator foramen. We already established how the alignment of this foramen is formed. So if you look at it, we say that we have the ischial ramus. We also have the superior and the inferior rami of the pubic. So these bones will come together to form a circular alignment that will be creating this opening that is referred to as the obturator foramen. We see that this foramen is also covered, but incompletely. So it is covered incompletely by the obturator membrane. And this is what is highlighted here in blue. And this is what leaves a space here as the obturator canal. We say that this compartment is what gives the orientation sides for the fibers of the obturator internus. So you have the fibers of the obturator internus emerging from the posterior surface of the obturator membrane that is highlighted here in blue. So the posterior surface of the obturator foramen. And this is how it emerges from this region before it is finally directed to be exiting the pelvic cavity through the lesser sciatic foramen. So it's good that we're able to highlight this feature when studying the obturator internus. It's also good for us to highlight the obturator fascia. The obturator fascia is different from the obturator membrane. Remember that the obturator membrane in this upper image is what is seen to incompletely cover the obturator foramen. If we try to use this lower image here, this is where we say we have the obturator internus muscle. This muscle is seen to originate from the posterior or the internal surface of the obturator membrane, also the border of the obturator foramen. We say that this structure, the obturator foramen and the obturator membrane, are embedded deep into this space. And this is why we cannot see them in this image, but we try to unfold them in our previous slide. So we have the obturator fascia here, highlighted in white. This fascia is seen to be lining the posterior surface of the obturator internus muscle. You see that this obturator fascia is what is highlighted here at this point. This is the posterior view here, and this is the posterior surface of the obturator internus. So you see a fascia covering over the posterior surface of the obturator internus. So it means that this obturator fascia will not be related to the obturator externus muscle. Remember, we tried to highlight the obturator externus muscle too in our previous slide. We said that the obturator externus the fibers will emerge from the anterior surface of the obliterator membrane. That means deep to this space, we have the obliterator membrane. From the obliterator membrane, posteriorly, we have the emergence of the fibers of the obliterator internus. While from the anterior surface of the obliterator membrane, we'll be having the anterior emergence of the obliterator externus. So this is why we say that the obliterator fascia is not related to the obliterator externus, but it is solely related to the obliterator internus. So you see it lining just on the posterior surface of the obliterator internus muscle. So it is seen to be positioned deep. So it is not related in any way to the obliterator externus, because the obliterator externus is seen to emerge from the anterior surface of the obliterator membrane. And the obliterator membrane is positioned more anteriorly, while the obliterator fascia is seen more posteriorly. So if we try to take up the layers as it is shown in this image, you need to remove the obliterator fascia before you then see the obliterator internus muscle. So after removing the obliterator internus muscle, the next structure that you see will then be the obliterator membrane. Remember that the obliterator membrane will be acting as an intersect between the obliterator internus and also the obliterator externus, because we say that the fibers of the obliterator externus will be emerging from the anterior surface of the obliterator membrane. So in case we come across this during our dissection practical anatomy classes, we should be able to state how these structures are related to one another. So we have the obliterator fascia here highlighted at this point. We also have further transformation of the obliterator fascia, and this is referred to as the white line of the levator ani. So we have an arc-like thickening of the obliterator fascia, and this runs in form of an arc, and this is why it is referred to as a tendinous arc. So you see it along this course. This is just a thickening of the obliterator fascia, and it is seen to extend here from the body of the pubic bone, and you see it running like an arc-like pattern to the ischial spine. This is where we have the ischial spine here. So you see that it runs along these two sub-regions, and of course, creating an arc-like presentation. This is a thickening of the obliterator fascia, and this tends to create the attachment point for the levator ani muscle. So finally, this tendinous arc that is referred to as the white line of the levator ani muscle, just because it creates connection points for the levator ani muscle, it is seen to further subdivide the obliterator internus into the pelvic part and also the perineal part. So within the pelvic cavity, remember when we started this lecture, we said that the obliterator internus muscle has a pelvic region and also the gluteal region. So the pelvic region is then further subdivided into the pelvic part that is harrowed here in dotted green, and also a lower part here that is harrowed here in purple, and this is referred to as a perineal part. So because we have this arc-like demarcation creating the connection point with the levator ani muscle, and we know that the levator ani muscle is what forms the inferior limit of the pelvic cavity. After the levator ani muscle on the inferior part, we have the perineum. So we say that this inferior region just below the levator ani is where we have the perineal part of the obliterator internus. This is just in a way further subdividing the pelvic region of the obliterator internus into the pelvic and also the perineal subregions. And this is what is created by the white line of the levator ani. So it's good for us to be able to illustrate how these structures are formed and also how they are related. So let's go through some facts about the obliterator internus muscle. The obliterator internus muscle is seen to separate the two gemini muscles. Remember, we described this a bit in our previous slide. This is where we say we have the obliterator internus muscle here harrowed in yellow. We say that above it, we have the superior gemellus, and this is what is harrowed here in black. And inferior to it, we have the inferior gemellus muscle, which is also what is harrowed here in black. So we have the superior and the inferior gemini muscle here, located superiorly and also inferiorly to the obliterator internus. So we can say that the obliterator internus, specifically around the gluteal region, is seen to separate the two gemini muscles. This is what is exhibited here in this image. Remember, we already described that the obliterator internus muscle has a pelvic part, also the gluteal part. It is not the pelvic part that it is seen to separate this muscle, but it is specifically within the gluteal subregion of the obliterator internus. And this is where it is seen to separate the superior gemellus muscle from the inferior gemellus muscle. And more superiorly, here you have the piriformis. Remember, we already described this in our previous lecture. If you check up our lecture on the piriformis, please kindly go and do so. While more inferiorly, we have the quadratus femoris. All these muscles form the structural components of the deep compartment of the gluteal region. We try to highlight them also in our lecture on the gluteal region. So this is what is seen around the gluteal space. So you see the obliterator internus here between the two gemini muscles. So at the lateral edge here, they now share a common tendon around this region that is highlighted here at this region. So you see that the tendon from the superior gemellus, the obliterator internus, and also the inferior gemellus muscle here at this point that is arrowed in blue, they are now seen to come together to form a common tendon at this lateral edge. And this is where they are finally inserted on the greater truncator of the femur. So they have a common tendon formed from these three muscles. And this is where the collection of these three muscles, the superior gemellus, the obliterator internus, and also the inferior gemellus, are referred to as the triceps cortex. So let's go through the action of this muscle and also the vessels that provide blood supply and also innervations for it. So this is where we say we have the obliterator internus. The action of this muscle include lateral rotation and also abduction of the thigh when the hip is flexed. It is also seen to help stabilize the head of the femur within the acetabulum. If you look at how the fibers of the obliterator internus muscle emerge and also the part that they run and finally inserted on the greater truncator of the femur, we say that they tend to create a common tendon around the space with the superior and the inferior gemini muscle. If you look at the part that it runs, you see that it is seen to run over the hip joint. And within the hip joint here, we have the head of the femur fixed into the acetabulum. So it's helping to also stabilize the head of the femur within the acetabulum. The blood supply of the obliterator internus is from the corresponding named artery. The obliterator artery is what gives blood supply to this muscle. The obliterator artery is one of the branches from the anterior trunk of the internal iliac artery. We also try to describe this also in details in our lecture on the internal iliac artery. So if you check that lecture up, please kindly go and do so. For the innervation is by the nerve to the obliterator internus. And the nerve to the obliterator internus is formed by the ventral division of the ventral rami from L4, S5, and also S2 spinal nerves. So this is how the obliterator internus is provided blood supply and also how it is innervated. Thanks for watching this video. Let's continue to stay glued to this channel.